Hello, everyone. Welcome back to the XCEL podcast, where we help you become the best version of yourself. I'm excited today because we have a fantastic guest, KJ Whittaker, who is our newest clinician here at XCEL Physical Therapy, and not only one of the best people that I know, but also one of the best clinicians that I know.
Thank you.
So, KJ, welcome.
Yeah, thank you very much.
Yeah.
Excited to be here.
Yeah. So we're figuring this out. Like, KJ and I, before we hit the record button, actually Jared hit the record button. We're like, man, we don't know what we're doing here.
Right. Where do we sit? How far?
Yeah. It's like, do I show my bald spot or do I try to keep it hidden? But one of the things I wanted to cover with you today, KJ, I really want people to know who you are.
Yeah.
And how much value you provide in the community over the last 25 years, 26?
Yeah, I'm back in the Quincy area since 2003.
Okay.
I've been doing it as a PT now for 27 years, actually. So
I was just learning to drive at that age, KJ. So just to make sure you're aware of that. But
I got a few years on you.
Yeah, just a couple.
Yep.
But if you don't mind, share with our listeners just who you are, and talk about your family, whatever you want to talk about.
Yeah. So I'm a Quincy native. And a graduate of Bradley University Physical Therapy School. Spent a couple years up in Chicago. Knew that was not the right move. And then my wife, Julie, and I went to Springfield. Worked over there for about 5 years before moving back to the area. My wife's a physical therapist as well. She does pediatric physical therapy, and so we do the same thing but very different things at the same time. We met during physical therapy school. Okay. Knew each other, started dating during physical therapy school, and then decided to come back to raise our kids here. And so we've been back here since 2003. Our kids are Ben and Gabe. Ben's about to graduate from the University of Kansas.
Rock Chalk.
Yes, Jayhawk. And our younger son, Gabe, is a sophomore at Rockers. He plays soccer over there. And so we just couldn't be prouder of them and what they're doing with their lives and the people that they're becoming.
So if only they had a good physical therapist at home and they got injured, I mean, whatever sporting activities they were doing.
We've done a lot of that at home. Yeah.
One of the things that KJ has been able to bring on board here at XCEL, even just the first few weeks, you make us better clinicians. KJ has a standard. I mean, it's cool to see him work. I've never really had seen you work before, in a clinic setting. I'd heard all these stories like KJ, like who the heck is KJ?
Right.
Well, now I know. And, you bring a lot of experience, but also a lot of relationships, over here to XCEL. So one thing I want to touch on is in your years of experience, how has physical therapy changed from back in 2003? You graduate, or not 2003, but at the beginning of your career, how much has it changed from what physical therapy is to today?
Yeah, it's changed a lot. When I was in physical therapy school a long time ago, there was a huge emphasis in our education on modalities. So heat and ice and electrical stimulation and ultrasound and ionophoresis, and I learned a lot about those things. And one of the things that I like to joke about is I know more about the things that do the least amount of good than anybody else in the clinic. And that just means I'm older than everybody else is. And so over the years, though, what we've done is we've become far more skilled. Yeah. Skilled with our hands, skilled with our exercise prescription, making things much more about function. Yeah, we still want to make people feel better and decrease your pain, but we have better ways of doing that, addressing why you're in pain in the first place and making people functional so they can get back to doing the things that they love and things that they can't do anymore.
Being able to do the things that are important to them outside of these four walls, because I said this in a previous episode, but if we don't get people better, they don't come back in the door. Right. We have to actually see some actionable, evidence-based improvements each session. And one of the things that I really learned from you in the last few weeks since you've been here is you test and you retest. I didn't put this on our list of questions, but so I'm throwing you a curveball here. But can you talk about the importance of every time that somebody comes in here, you're reassessing them. You're looking at them testing and retesting. Can you speak to that a little bit?
Yeah, I think it's one of the most important things that we do. One, so we know that we're making a difference with people. So what we mean by test, retest. So maybe you have low back pain, and so the first thing I'm going to look at every time you come in is bend forward and touch your toes, bend backwards, bend to the right side, bend to the left side. How far do you move? What's the quality of movement? Do you have pain with that?
Yeah.
And then we're going to look and do some more tests to see why that didn't go as planned. How do your hips move? What's your strength? Those sorts of things. And then we're going to do a treatment. And then we're going to test again. And we're going to see, do you move better? Do you bend forward more? Do you bend backwards more? Do you have less pain when you do those things? And what that does is twofold. One, it makes me sure that I'm doing the right thing. Did I choose a treatment that improved how you move, that improved how you function? But it also has the patient see that, hey, this treatment makes me feel better, makes me move better. And when you do that, they see it, and then they know that, well, if I continue to do that at home, then I can feel better and move better. And so it's a way for me to learn, and I've learned a lot from test-retest over the years. It's taught me what works, what doesn't work with this particular patient, with that particular patient, and it teaches you pattern recognition, which is a really important thing. But I think the bigger value is that the patient sees what works, and they see that they feel different after doing a technique. And then if it didn't work, and that's equally valuable, then you have to try something else.
Try something else.
And find the thing that does work for them.
Got to pivot. Yeah.
That's exactly right.
I'm glad you said that because not cookie cutter. There's a lot of, and I think physical therapy as a whole, correct me if you feel differently or if you think I'm wrong here, but I think we've fallen into the trap of cookie cutter approaches sometimes. So that's what I've learned just in the last few weeks from you is test, retest, because they might have looked this way when they first came in, but they went and they stepped off a curb, or they did something different at home or at work, or they slept differently, and now they're presenting with different symptoms. We have to retest them. Okay. You
absolutely do. I couldn't agree more. And I think the cookie cutter approach is easy. It's easier to do in a clinic where you're pressed for time, where you maybe aren't comfortable with what you're doing, or you're just learning some new techniques. It's easier to go back to what you're comfortable with.
Yeah.
But the real the thing I really enjoy about what we do is sorting out why. Why do you have a problem in the first place? It's not normal for a 30-year-old to have severe back pain or whatever the case may be.
Sure.
And so why are you in this position? And so figuring out the why, and then can we cater and customize our treatments to what you have going on, so that we can address those specific needs.
You're a PI. You're a private investigator. You're really diving in. You're trying to figure out, that we know the symptoms, we know the impairments, but why is this happening to you? Whether you're 35 or 85, what's going on?
Absolutely.
Right? So I want to transition a little bit because I think, if I were to just pull a random person off the street,
sure,
and I said, hey, have you ever been to physical therapy before? And they might say yes, they might say no. They're going to give us their answer of whatever their experience was. But physical therapy doesn't always have the best reputation. So I want you to speak to the person that is listening to this, and maybe they've had a not so great experience in the past with PT. And what would you communicate to them to help them better understand, like, hey, we're different here at XCEL? What would you say to them?
Well, I think the thing you hear from them a lot of times is PT stands for pain and torture,
Right.
And I hear it and I chuckle, and then I try to go about sorting out the why, as I talked about before. So, listen to them and find out what their complaint is. Why are they here in the first place? And then try to figure out why are they having those symptoms.
Yeah.
And the best way to do that, and something that I think that we're uniquely equipped to do, is have people come in for a free consult, spend some time with us, let us educate you on why we think you have your issue, whatever that may be in the first place. Does your back hurt because your hips are stiff, or are you spraining your ankle because you have a weakness at your hip, or whatever the case may be? And spend some time with us. Let us examine you and tell you what we think a good approach to that would be, and maybe we do a little test-retest in that time.
Exactly.
And see that, when you tried this little exercise, or we tried this little hands-on technique with you, that you move differently and you feel better, and how can that be incorporated into your life, and then we can progress it from there to make a difference for you.
Yeah.
So I think that's probably the best way is to come in and spend some time with us, as opposed to trying to talk about your specific problems when you're not in front of us. I get that question, from family all the time, or, you're at the Thanksgiving and it's like, well, my back hurts, and what should I do about that? Well, it's not like that, I have my brother-in-law who's an accountant. I say, well, what will I owe in taxes this year? And he says, well, I don't know. I need to look at your information. And it's the same thing.
Right.
So it has to be customized to you.
I'm glad you said that. I think really in all aspects of life, we have to figure out what the challenges and the problems are.
Mm-hmm.
We can present a solution, but if it's not the right solution to the problem that they're having, it's, again, to go back to 2 words, cookie cutter approach, right? And unfortunately, I think because reimbursement continues to go down in our profession because of a whole host of reasons, we've tried to get more people in through the door, and that's not always the best thing. Quality continues to go down at times, right? And that's a big problem in our profession. So go ahead. I think you had something to add there, but
no, it is. It's a big problem in our profession, and all of us feel the crunch to see more patients and to try to be more productive. And productive means more patients in a shorter amount of time. And I think that's one of the things that I've enjoyed most about being here is that we do have the time. The time to sort out what we need to do to help people. And for me, it's really helped me enjoy our profession more than I have in a while.
Yeah, no, that's great. So that's actually a really good segue, because that was going to be you kind of stole my next question from me, KJ.
Sure.
Was, in your own words, how are we different here at XCEL Physical Therapy?
Well, I think you feel it when you walk in first. We know your name. We spend time visiting with each other, talking about what we can do. I may be stuck with a patient, but we're going to spend time as a staff talking with each other, and we have a staff who has a wide variety of experience and expertise in different areas. And so maybe I'm not the best therapist for you.
Yeah.
And Brian, who is going to have a wide variety of experience in functional exercise and higher level progression of exercise. Well, maybe that's the right person for you right now.
Right.
And so our egos aren't going to get in the way and keep us from doing that. And so that's one of probably the biggest reason. But we also we put more time on the schedule to evaluate a patient, and that's the most important part of what we do. That first evaluation, because what it does is it allows us to establish a relationship and to sort out all the reasons that are all the things that are contributing to your dysfunction, and then what are your goals? What is it that we're trying to accomplish with this? What is it that you want to get back to? What is it that you can't do? And we come up with a plan as to how we can do that together.
Perfect.
And so there's more time dedicated to that, which is an important piece of the puzzle.
It is. Developing a relationship. I don't think I know we didn't get enough of that in school, and I think being a human being, we also have fun here. I mentioned that in a previous episode. We have a lot of fun here, maybe a little too much sometimes, but look, I think the patients enjoy that.
They do. I mean, people talk about it all the time.
They do. They say words like, "Hey, you guys are a family here." Like they can tell that we genuinely care about them. So, no, this has been great. We could go off and dovetail on about 100 different things based on what you said. And just for our listeners, KJ is going to be a regular contributor to this podcast. We want him to come on and provide a lot of value with the knowledge that he has, as well as be able to show some specific techniques. If you're having back pain, if you're having if dizziness or vertigo, KJ's a specialist in those things. So we want to be able to help people. You don't always have to walk in through our door to get some help, right?
Right.
There's a lot of free content and resources that we're going to continue to provide. So as we start to wrap up here, KJ, thanks again for coming on board here and also to contribute today.
Yeah, it's been enjoyable.
Yeah, and to our listeners, please share this and let us know if there's any topics that you want to know about. Ask it of KJ. If there's something that you're currently going through or experiencing, this guy has a lot of experience and a lot of knowledge to share. So we're going to wrap up here for today. But again, to our listeners, thanks again for tuning in. This is XCEL U.